All right, great. Welcome everyone. We are live on Facebook Live also. I'm going to turn it over to our friends in just 1 second, but really quickly, we are going to ask everyone to hold questions for the end. And at the end, we will end the live stream and recording, so we'll have some time. We will have some time for questions more privately at the end. If you'd like, you can type any questions in the chat if you don't want to forget them. And if you are watching us on Facebook Live, feel free to type questions anytime in the comments section, and I'll give those to our speakers at the end so they can answer those for you. So now I will turn it over from Delaware Hospice. We have Susan, as well as Kayla from Delaware Hospice, and here is Susan.
Good afternoon, everyone, and thank you for joining us. I know it's late in the afternoon, so hopefully I'll keep everyone awake. So I am from Delaware Hospice, as is Kayla. I am the practice manager for our palliative care and our dementia care programs. Kayla works with all of the programs here at Delaware Hospice, and we're really excited to talk to you today about palliative care, what it is, what kind of patients are appropriate for palliative care, how we might be able to help you. As Kate said, don't hesitate to put questions in the chat. And if not, if you hold them until the end, we'll make sure we get to everybody's questions. So just a few disclaimers. This presentation is proprietary of Delaware Hospice. Under no circumstances should the materials be copied or transmitted or disclosed to third parties. And all information presented today is informational purposes only. So about us. Delaware Hospice has been around since 1982. We have served nearly 170,000 patients and families since we started as an organization in 1982. And that is amazing to think about how many lives we've touched, how many people we've supported. And if you talk to anybody at Delaware Hospice, we are here because we love what we do. We love taking care of people. And we understand that, you know, this is a journey. We understand that this is a hard time for a lot of people, and we just want to be here to help you in any way that we can. I won't speak for Kayla, but I can tell you that I've been in palliative care for 7 years, and it is such a rewarding place to work, not only because we work with really amazing people, but we really believe in what we do, and we believe in helping people, whether that's symptom management, taking some of the burden off of the patient and their caregivers, or even helping patients transition at end of life. This is really just something that we all care so much about, and that's why we're here. So palliative care at Delaware Hospice. Palliative care is appropriate for anyone that's been diagnosed with a chronic life-limiting illness. I'm going to read you a definition of palliative care because sometimes this helps people to understand a little bit, but we're going to talk a little bit more about this definition. Palliative care is a medical specialty aimed at optimizing quality of life, reducing symptom burden, and suffering of patients with serious, complex, and sometimes terminal illnesses. So what does that mean? This program can help patients with diagnoses such as cancer, heart failure, chronic kidney disease, dementia, pulmonary, so COPD, patients that have trouble breathing, anything that affects your quality of life and your ability to live your daily life and do the activities that you would normally do. If that's affected, then you're probably appropriate to talk to palliative care. We can begin as early as the first day of a diagnosis of a chronic serious medical illness. We provide care at palliative care alongside your other providers. So with palliative care, we are not asking you to give up any treatments. We're not asking you to stop seeing providers. Palliative care is going to work with your providers. We're going to focus on things like symptom relief, pain management, and support. Some of the other things that palliative care can do is assisting with things like a DMOST or an advanced directive. Some people also call these living wills. Those are things that we help patients with every day. So When you think of palliative care, you want to think of palliative care as a medical specialty. So your oncologist, your pulmonologist, your ophthalmologist, those are all specialties. Palliative care is a specialty. So you come to palliative care when you need things like symptom relief or, help with quality of life and burden. Palliative care is a holistic approach, which includes patients' medical, physical, emotional, and spiritual needs. Palliative care not only focuses on the patient, but very much on the supporting caregivers as well. Palliative care is a covered benefit with most insurances. We say most because some insurances pay for palliative care at certain organizations. So if we don't have a contract with a certain insurance, maybe a commercial insurance or a Medicare Advantage plan, Delaware Hospice will still work with patients to see if we can reduce bills in any way. We have a financial assistance program, but most insurances cover palliative care. Palliative care is not a replacement for primary care providers. So when you come onto palliative care, there are a lot of things that we're going to offer to help you with, but there are also going to be things that we tell you to keep your other specialist and primary care provider for. We don't manage things like diabetes or hypertension. If you have chronic medical illnesses, those are things that we tell you to make sure that you're keeping your other providers for. We want to complement your other providers, not take care away from them. Some things that palliative care does not offer. We don't have the ability to draw labs at home or administer infusions or medications. We can't manage chronic pain related to traumas, injuries, surgeries. We're really focused on pain that is directly related to the medical illness that you're coming to palliative care for. So for example, a cancer patient having pain from either the tumors, from radiation, those are the types of pain that we typically help with. We don't have CNAs or in-home nursing. So we have providers that come to your home to see you, a nurse practitioner, possibly a physician or a social worker, but we don't have nurses and CNAs that come out to help with personal care. Palliative care and hospice are a little bit different because palliative care, again, is given alongside treatment and with other providers, whereas hospice is really, when you think about sort of terminal, end of life, focusing on comfort care. So sometimes people hear palliative care and they think hospice. We're definitely different from hospice. We can certainly help with transitions to hospice if and when that time comes. But we're not stopping anything. We're continuing to make patients comfortable and improve quality of life, but not for terminal illness at all. It's any patient at any stage of a chronic serious illness. We don't have the ability to manage things like tubes, drains, IV lines, all of those things. Those are things that a home care nursing company would still need to be involved for. We do have a nurse that covers urgent needs. So if there's a patient that's having an issue, you can call our office at any time. We have nurses on call 24 hours a day, 7 days a week. Most of our nurse practitioners take calls directly from patients. We also have a medical assistant that helps with taking calls, but there's always somebody available at Delaware Hospice and Delaware Palliative. So a little bit about our care team. Again, we have a palliative team physician. We have a team of 7 nurse practitioners in our Delaware Palliative team. We've got nurses, we've got social workers, we've got administrative staff. That's staff that's answering the phone. That's medical assistants gathering your information. There's administrative staff always working in the background. We've got chaplains and we've got volunteers. So we're here for you. If you have questions today, I'm certainly going to try to answer them all. But if you think of questions in the future, or if you think that our program can help you, we certainly want you to give us a call. You can call and ask for me. My name is Susan Roberto. Again, I'm the practice manager. You can call and speak to anybody in our referral center staff. Um, we're here for you. So I'm going to open up the floor for questions about palliative care, how that might directly help you. Anything that you're thinking that I didn't cover. There's a lot, so we could talk.
And again, if you're watching on Facebook Live, please type your comments, your questions in the comment section. I'll give you guys just a minute or two to do that, and then we'll end the Facebook Live portion so anyone on Zoom can ask questions more privately if they'd like. But feel free to ask anything now if you'd like here.
I have a question.
Sure.
Susan, you mentioned that palliative care will help with the DNOST.
Mhm.
Can you talk a little bit about that? Because I know that's a document and you have to go through some steps to get it. Could you elaborate a bit?
Sure. So the DMOST is a document where patients and families can write down the patient's wishes, and those wishes are honored as any other legal document would. We help you walk through those documents to determine what is it that that patient wants for their care, what is it that they don't want for their care, who do they want making those decisions. If you were unable to make decisions, who are you helping, or who are you asking to help you make those decisions or to carry out your wishes on those documents. Once we complete those documents, we actually upload them to a system that any hospital or other provider in Delaware can access. So those live in your medical record. I encourage people to update them as needed, but certainly they're there. And that way, if somebody were to have a medical emergency and they have a DMOST that says, you know, these are the things I want, these are the things that I don't want, that's accessible to any healthcare provider in the state.
How does that differ from advanced directive? Because it's legally binding?
They're very similar. Some patients have advanced directives or living wills drafted up by an attorney. This is not drafted by an attorney. This is something that we witness as your medical provider, and we also ask for you to have a witness outside of our team to say, yes, this person has said, and they have the ability to make that decision. This is what they want. But they're very similar in the way that they direct what a patient is requesting for their care.
But the DMOST is it's legally binding, isn't it? Can't an advanced directive be overridden by like family if at the last minute they decide, yes, we know we want a resuscitator?
So, yeah, sorry, Kate, were you going to say? Oh, sorry, Kate, I thought you had unmuted to say something. So any document that somebody puts in writing that says, these are the things that I do and don't want if I can't make my own decisions, your next of kin or your power of attorney can override that, but it makes it a little bit harder. The medical providers are expected to follow your wishes. These are legally binding, but I have been in situations, I worked in an ICU for many years where a power of attorney decided to go against someone's wishes, but then those things become issues with the legal system and in that healthcare organization. And usually we try to encourage people at the time of filling out that DMOST or advanced directive with us to really talk with their loved ones and their caregivers. Why is this what you want? If your family doesn't agree, let's talk about that. We're happy to sit in your home for hours and have those conversations, especially when people don't agree. That's something that we see a lot. And we're there to support you. We're there to make sure that whatever that patient and that family is struggling through, we're there with you. So we like everybody to be on the same page, but yes, there are ways to go around what someone has put in a legal document
Uh,
for their wishes.